In the meantime, the 4 people who were seriously injured continuing to receive treatment in hospital for what we're told from the ambulance service are life-changing injuries. They are currently recovering in hospital. We have no further updates on their current condition.
OK, Fraser, thanks for the update.
The head of the NHS, Simon Stevens, today he is going to explain how the health service can cut costs by £22 billion in the next 5 years. He's going to be speaking at the NHS Confederation. That's happening in Liverpool, and its chief executive, Rob Website, joins us now live from there. Yeah, sorry, it says, I'm looking here at your name and I'm saying it's Website, and I'm saying that's an unusual name, that. But anyway, somebody's obviously typed that in completely wrongly, Ronan. Thank you.
I've not been called that before.
No. Tell me this. Costs down by 22 billion in the next 5 years. What's your thinking on that?
So we've got about 3,000 people coming here over the next 3 days from across the NHS to look at that very question. Now, how do we make sure that we deliver the best possible care we can for people in England over the next 5 years by redesigning the way we deliver care? We know we spend £115 billion now on the NHS. The government has committed to increase that by at least £8 billion by 2020. We've got to come together now with our members, with people like Simon Stevens, with the Secretary of State to say, well, this is how we're going to do it.
How enthused are you by that, Rob? I mean, we had a GP on the programme this morning who just said the whole idea of this is a fairy tale.
Well, I think there's a real responsibility for us as public servants, and a real responsibility for us as the favoured part of the public sector that is getting some investment to make this work. Many of your listeners, your viewers at home, will be sitting there thinking about the care that they get and how it could be more joined up, more delivered at home, more delivered in their communities, and delivered differently for the way that they live their lives today. We know that the NHS spends most of its money on people with long-term conditions, people who are older, people who are frailer, people who we've got a long-term relationship with. So if we start to think about delivering care differently for them, we think it can be better, simpler, safer, more cost-effective for everybody. So we should be incredibly enthused by this, because it's the thing that drives us to do our jobs.
OK, I'm glad you think you can achieve it. Rob, we've got our news panellists here sitting reviewing the newspapers this morning. Ian Royce would like to have a word with you.
Hi, Rob. I was just wondering, the NHS is at its limit at the moment with and under so much pressure. How is cutting costs from the NHS a good idea when the government's reinvesting more in the NHS? Surely we need to keep investment in the NHS rather than cutting stuff, because at the moment it's at its peak and at the end of its tether almost, it would seem. So by cutting, is that actually going to help?
So what we've had, what we know each year is that demand for services goes up by about 4%, and the resources haven't quite kept pace with that over the last few years. So we've been working incredibly hard with our members, local GPs who now think about how services need to be delivered for patients, local hospitals and community services, to say, how do we deliver this differently? And in the last 5 years, we actually saved about £19 billion in the NHS. But what our members tell us is that we're under huge pressure. We've just done a survey that shows more than 70% of them say that these are the toughest financial arrangements that they've known throughout their entire career. So that gives us extra impetus, I think, to look at how do we actually deliver care in ways which are better, simpler, more cost-effective, and deliver for local people. What we are getting is some investment in the NHS over the next few years, and it should continue to grow. What we need to do is look at how we use all of the resources available to us to better meet the needs of people, and that requires people like Simon to get behind local hospitals and GPs and community services, and the Secretary of State to give us the political will to make the change happen locally.
OK, Rob, have a good conference. Thank you very much indeed. Rob Webster there from Liverpool at the NHS Confederation.
I think the NHS is a fantastic asset to this country, but I think it's time we stop being sentimental about it. You know, in the election it was carefully billed as our NHS. It's the biggest state monopoly in the world, and it's time they started rooting out all the waste and run it like a business. Yesterday in the news was about nurses being paid you know, thousands of pounds a day because they were coming from agencies. That's just poor management. People are given